Here today, if you would please raise your hand if you have not attended a Safe Streets Coalition meeting before. Thank you very much. There is a membership form in the center of the table if you'd like to fill one in. How about that? Okay, if you would take just a few minutes and sign your name on the yellow form in the center of the table. And also you'll see a survey. So if you would complete the survey before the end of the meeting and just leave it on the table, that would be helpful. This helps us to select the programs that you would like. And of course, there's no cost to join the coalition. I have to throw that in. Okay, today I would like to introduce the staff at Prevention and Recovery Services. We have our Executive Director, Michelle Voth. Lynn Smith, right here, he's our Community Prevention Consultant. Have Irene Caballero, she's our Bilingual Community Mobilizer. Michaela Butterworth is our Education and Communication Specialist. And I'm Judy Wilson, the Office Coordinator and National ADAPT Program Coordinator. Today we have our Champion of Character, Detective Charles Wilson. If you'd come forward. I don't know who the rest of them are. Okay.
Well, we appreciate you folks having us here today. Detective Wilson was telling me the incident that he's being honored for. He was in the moment, and he was doing what his training told him to do when he aided a citizen who'd been in a car wreck and gave some first aid response that was life-saving. And he said in that moment, he was doing what his training was showing him to do and what his calling as a police officer had led him to do. And all of the accolades and honors that he's received at this function and various functions in other organizations for that event have been more nerve-wracking on him than the actual incident. And I told him that's as much of a police tradition and a first responder tradition as anything is for that. But we are honored, he's honored, and I'll let him say something here in just a minute if he chooses to. I'll give him a heads up. I gave him that much warning that he might have to say something for you all, but he does appreciate it. Charles is a valued member of the police department and by extension the city. We appreciate the city manager being here today too, who was very much aware of the situation and presented Charles with an award for this similar incident earlier this year as well. So we appreciate the support of the city manager and city government for the actions of the police department and the first responders. But Charles is a little nervous in regards to this, but I will let him say just a hair. But we are very appreciative of the long-term partnership with Safe Streets, and we're definitely appreciative of the honor that you have disposed upon to Charles today in regards to his actions on that day. Charles?
Sure. I guess the first thing is to say thank you for recognizing me on that kind of deal. I know for our city, it's real easy to pick out the negative things and the way that politics and turmoil are. It's nice to see that there are people out there that are registering there are good things that happen in our town and our city and with our department employees and other things. So I appreciate the recognition, and I appreciate the support that you have for both, the citizens as well as the government staff that we here trying to help everyone. So thank you.
Do you want to thank who's also here with you?
Yeah. So good thanks to Sergeant Burns, my buddy, but also my father, Dwayne Wilson. If you'd stand up. Yep. So, and my family. So I appreciate the support and what they're here for.
I promised the family that I would get them some recognition when I was at the table as well, but always about bringing people in, that's what we do. So but once again, thank you very much on behalf of the department and the city for recognizing us. The first responders are people, as you well know, in this room, just like anybody else, and we appreciate recognition. Thank you.
Yes. Thank you.
Thank you, Deputy Chief Willis. Also, if you have not filled in a Champion of Character Award form. We do have them available at Safe Streets. I didn't bring some with me today, but if you'll email me or call me, we'll be glad to see that you get a form to complete. The October minutes have been emailed to you and placed on your table. Today, I would entertain a motion to accept the minutes. Okay, motion been made and seconded. All in favor, say aye. All opposed, no. The motion has been approved. On the back side of the agenda today, you'll notice some upcoming meetings, and also on the slides. We have a retailers meeting on November 13th, the IFO meeting on November 21st, and again, we'll be back in here for the Safe Streets Coalition on December the 4th. Retailers on December the 11th, and the IFO meeting on the 19th. As you can tell, we've had several neighborhood watch meetings this month and many more scheduled. We have quite a few new neighborhood watch meetings, so that's great. On our presentations, we've had several trainings this month as well. And when you go down to the substance abuse initiative, you'll see presentations there. Dana, who's our counselor, she went to the addiction and trauma for USD 501. And then Lynn, which I don't have his listed on here, he did a drug trends at 501. He was at Shawnee Heights Middle School 3 times, Shawnee Heights Elementary School twice, and French Middle School once. So they're out working with the students in our neighborhoods and in our schools. If you would like to have a presentation for your work or your organization, please let us know, and we'll be glad to come out and talk with you about that. Sergeant Michael Burns, would you come up? He's going to deliver our crime stats.
All right, we're going to go over our crime stats for city violent crime. For the most part, they're all down. I do want to highlight our robbery to the businesses are down about half. This is contributed to the hardworking members of the Topeka Police Department, Sheriff's Office, KHP, all working together. I believe also we've been talking to business owners. They've been listening to the Safe Streets presentations, our presentations, and are becoming more aware of some of their surroundings and doing a good job getting those down. Go to the next slide. And for the most part, our city property crimes are all down as well. Looking at the burglaries, those are down. And again, that's also contributed to homeowners being aware of SEPTED ideas, being aware of who's in their neighborhood, who's not belonging in their neighborhood. And then our property crime detectives are doing a really good job trying to get all those down as well. The Topeka Police Department hosted a trunk or treat event at the Law Enforcement Center on Halloween. It was a great turnout. You know, it's always good when you're seeing the line, you know, blocks down the road, and as the hours go by, the line never gets smaller. So it was a great turnout. We did have the Battle of the Badges on October 27th. Unfortunately, the fire department did win that one, sad to say. But the real winners are the Special Olympics of Kansas. We work with them throughout the year. It's one of the highlights of any officer, in my opinion, is seeing the athletes and the participants with Special Olympics. And if anyone in the room has not participated in an event, get a hold of myself or Dan Wilson. We'll get you out there. And as soon as you work an event and you see the smiles on these kids, you're going to be hooked for life. And who is ready for the holiday season? It is that time of year already. Can you believe that? So just some safety tips for the holidays. Hide or lock all valuables. Your car is not a gun safe. So no guns left in cars. Have keys out before you leave the store. Have packages delivered to you at work. We do have every year those individuals. We do have those individuals that will follow a FedEx, follow a UPS truck, and take your packages off your porch. So one of the ways you can deter that from occurring is having those packages delivered to you at work. avoid shopping alone if you can help it, and then park in well-lighted areas. Those are some of those SEPTED ideas. Lieutenant Roth has put together a plan for the holiday season. You're going to see additional officers on the Wanamaker corridor in our shopping areas. We're going to be out and about. If you guys see us, come say hi. We'll talk to kids. We'll be out in the higher shopping areas on Wanamaker, downtown, stuff like that. So we'll be out and about. And like I said, if you see us, just say hi. Good. Cool.
Thank you.
From the Shawnee County Sheriff's Office, we have Deputy Abigail Christian.
All right, I'm Abigail Christian, and I'm a deputy with the Shawnee County Sheriff's Office. I've been a deputy for 3 years now. Usually work patrol, so you'll see me driving through neighborhoods or enforcing traffic laws. I think my speed limit ticket of 15 miles or over is pretty lenient, so I've been temporarily, newly assigned to community services, so I'll probably see you guys a little more often. And yes. And today I'm here to talk about our Citizens Academy. Our Citizens Academy is a 13-week-long program. It starts January 8th and runs through April 1st. We meet on Wednesday evenings from 6 to 8 p.m. at the Law Enforcement Center. And it's just a way to help develop positive relationships between the Sheriff's Office and the community and kind of educate people about what we do and all the different departments and units that we have. If you want to be a part of it, I'll give you information about that in a minute. You'll see different demonstrations from traffic enforcement patrol officers, K-9 units, polygraph, crisis negotiation, computer crimes, criminal investigation. Our crime scene unit comes out. You'll hear about our use of force policy and what we have to work with. And then you'll see some demonstrations from our special weapons and tactics group. So, to be a part of the Citizens Academy, you must be 18 years or older, have no criminal record, and have some sort of interest in either law enforcement in your future or maybe just learning about law enforcement. So if that sounds fun to you, or if that sounds like someone you know might be interested, you can go to our website to find more information, or our Facebook page has our newly released media release with all that information on it. All right. If you guys have any questions, feel free to contact us, and thank you for letting me come speak with you today.
Good afternoon. It is actually after 12, so that's okay. I wasn't sure if I was going to make it or not. I hope you're enjoying this weather for the short amount of time that we'll have it. At our last Safe Streets meeting, PARS prevention consultant Lynn Smith gave an informative presentation on emerging drug trends in Shawnee County. I'm just wondering how many were here and heard. Okay, so I'm going to put you on the spot, see if you learned anything. What were the top 3 drugs that kids are using in Shawnee County? Okay, there's one. What's the second one? E-cigarettes, yeah. Okay, number 3? Pardon? Let's try one more. Another answer? That's close. Pardon? Okay, ding, ding, ding. One more chance. Marijuana, yeah. I don't know why you know that, but yeah. Okay, I'm going to ask you one more question, then we'll go on with our presentation for the day. So, what age do kids start using any kind of drugs, whether it's alcohol, tobacco, or other drugs here in Shawnee County? 13. Somebody learned something, because we had a range from like 6 to 15 and anywhere in between. We had the Family Feud answers last time. So last time we talked about emerging drug trends, and our staff thought there's a kind of a broader context of what's going on. and in Shawnee County that's not just related to substances, but also other health-related issues. And so we wanted to bring some of that information to you today. We want to share information about a community health improvement plan, and I'm curious how many of you have heard that term, a CHIP or community health improvement plan? Okay, not very many. Great. PARS and its Substance Abuse Task Force has been working with the Shawnee County Health Department on one of the priorities that's identified in the plan. But we want to talk about the whole plan. So here to give you some background on the process and its findings is Craig Barnes, who's Division Manager of Community Health Outreach at Shawnee County Health Department. So please help me welcome Craig Barnes.
All right. Well, first off, thank you very much for allowing me to take some time today to talk to you about the Community Health Improvement Plan. I know some of you in this room were part of the process. Some of you have already seen a presentation similar to this from either myself or some of my staff. Michelle, of course, stole my opening question. Of course, who knows what the CHIP is? But that's great to see that there are some people who are familiar with it. And as a piece of that as well, though, and I'll talk a little bit about it, but we did a community health assessment before this. So I'm curious in here, who was aware that we did a community health assessment before the CHIP? Handful. How many of you who were familiar with it actually took the survey that we'll talk about a little bit? All right, one, yes, woo, that's what I like to see. All right. So diving in, really, the first thing that I always like to start off when we talk about community health and especially the improvement plan is first, what truly determines health? And this graphic is really good here because what it does is really shows that there are a lot of different factors that impact health. Too often, and most of the time what we think about when we think about health, we think specifically health care, right? And so healthcare, yes, is a very important part of our community's health and our health as an individual, but it is only a percentage. It's about 20%. And then 20% is also then related directly back to our genetic code. But 60% of our health as an individual and as a community really goes back to what we call the social determinants of health. And so what those are, the factors specifically here, that are the socioeconomic, the cultural, the behavioral, and the environmental factors that impact our health. So that is living condition, that is jobs, that is poverty, that is income level, that all those different facets, and especially too when we talk about healthcare, but access to healthcare, transportation, can you get to and from your appointments, those types of things. So when we look at the community's health, we look specifically how can we ultimately impact those social determinants of health, the actual pieces of your day-to-day life that impact your ability to truly be healthy. And so what we're going to talk about today is kind of the process, how we came across deciding what our health priorities were here in our community through that assessment process, how we then prioritized those pieces then into the Community Health Improvement Plan, and then what our next steps are truly to impact our health in the community as a whole. So this is the Community Health Improvement Plan. All right, this is our second iteration. We had our first ever Community Health Improvement Plan that we published in 2015. That was a partnership with Heartland Healthy Neighborhoods, which is our community health coalition here. I have the privilege this year of being able to serve as the chair for Heartland Healthy Neighborhoods. It's a wonderful group. A lot of the faces I've seen in this group are part of Heartland Healthy Neighborhoods or part of the work groups that are part of that. So I thank you for the volunteer time that you have given into really improving health. When we develop a community health improvement plan, as you see here, there's a time right there. So when we look at a CHIP, we look at developing strategies, long-term interventions that we can impact over a given time. As we probably all know here, it's impossible really to impact and really make a change in anything. It doesn't even just need to be health in just a very short amount of time, whether it's 1 year, whether it's just a program. So we really look at systematic approaches through policies, systems, and environmental changes to make a long-term sustainable impact on the health of our community. So, I kind of stole that next bullet point there. But so what the CHIP is, like I said, is really it's a systematic approach. Probably most of you in here are very familiar with strategic planning in your day-to-day, whether it's for your organizations, community groups, the like. And so what the CHIP is basically our community's strategic plan to impact health. And the great thing about our community health improvement plan here in Shawnee County is we have a lot of integration into our community's economic plan through Momentum 2022. And so specifically, there's a work group, the Community Service Engagement Pride Group, that has a specific intervention and strategy that is to support the endeavors and the interventions based through Heartland Healthy Neighborhoods, who is the keeper of the CHIP. HHN, Heartland Healthy Neighborhoods, is the keeper of the CHIP specifically for one reason, and that's because it's a community-led organization. The Community Health Improvement Plan is not any one entity's plan. It truly is a plan for the community, by the community, to make sure that we are making sure impacts on the health behaviors and the pieces that the community wants to impact. And I'll talk a little bit more about that as we move forward. And really the key aspect to this whole process is that we're not only looking at data. We're not looking at just, the secondary and tertiary data we either get from the state or from the feds, but we're actually getting primary data directly from our community through perception surveys, through focus groups, town halls, different partnering organizations and the data that they collect that they then supply to us, like school districts for immunization rates, the like. Washburn University, when we look at like STI rates and things of that sort. So we do a great job of trying to collaborate as much as we possibly can with a multitude of sectors throughout our entire community. Again, going back to what I just said about this is not just one entity, it's not just the health department's plan, it's not just the Stormont Vale, St. Francis's plan, this is truly the community's plan as a whole. So, the first piece that we did when we look at creating a plan, as anybody knows, is to do an assessment. So I'm going to spend the next couple of slides here kind of talking about the process and how we got to where we are today. We'll talk a little bit about the plan in general, and then, like I said, next steps. So the first piece for any plan is to first create a community profile, to get a better understanding of the community as a whole, the demographics, the populations that you're trying to serve. And so when we did that for the first time this year, so we've done surveys in the past, but for the first time this year, we made the survey available in two formats, both written, so partnerships with community organizations to have a paper copy, but we also did it electronically. And so we partnered with a lot of community organizations to share that survey out through Facebook, through social media, different organizations' websites, and to draw them to this. Not only did we offer it in multiple formats for the first time this year when we did this, but we also made it available in both English and in Spanish. And so that was a great thing so that we were able to, Irene, thank you for your help on that and getting that out, so thank you. But we were able to specifically get some of the populations and the demographics that we have routinely failed to impact or failed to bring to the table to get what their perceptions and what their needs are, all right? Too often, what we see, and I'll talk about this, really this is kind of a segue into the second point here, too often as the people doing the work, right, we have our perceptions of what the needs are in our community. And so a lot of times we really get stuck looking at the data, the numbers. Well, data only tells really a portion of the story, right? We all know that. And so when we look at data, it informs our decision-making process for sure. But the community, when you really want to impact the community and you really want to build that buy-in, right, at that ground level and really develop that groundswell and that momentum behind an initiative, you really have to go to the community as a whole. And so the next really new thing that we did, and we every process there should be ongoing evaluation, right? And so what we learned from our first iteration of the Community Health Improvement Plan was we didn't do enough of truly going out into the community to get their perceptions of what their needs were. We really were stuck into the same people who are going to every meeting. They were our focus groups because they're the engaged people, right? And so we were getting their perception of what the needs are because they're dealing with those clients. So it was our goal this year to host town halls, smaller focus groups that we did over a much longer period of time. So we started in 2017, actually, hosting what we call our Faith, Our Health forums. We partnered with an organization called Communities Creating Opportunities to go into areas where we knew the highest health disparities were, based on the data, and to hold focus groups in some faith-based organizations and some churches to engage in a group of individuals who repeatedly had not been engaged into this work, and that was the faith-based organizations. So we started there, rotating, rolling into 2018, and really hosting focus groups now in neighborhoods. Too often what we realize, and when we look specifically at engagement in our forums, everyone hosts a meeting at the library, right? Or they host it at their organization. Because it's a centralized location for the most part, right, Greg? Right, yes? And that's not to say that it's not great, but sometimes, because we talked about health disparities, transportation is a major issue, right? And yes, maybe you're on a bus route, but maybe you're holding your focus groups too late in the evening because you're waiting for people on a different shift that you might not engage regularly. So our goal was to specifically go into the communities. And so what we did this year for the community health assessment in 2018 was to go to the communities. And so we partnered with the city of Topeka and the neighborhood relations to get contacts with the neighborhood improvement associations. And then to look at areas where the data shows so that their highest health disparities are. And so for us in our community, we're looking at really the 05 zip codes and the 16 zip codes. So you're looking at High Crest area, kind of that southeast part of town, as well as Oakland and that kind of north central, northeast corridor as well. And so we hosted town hall focus groups at the Avondale East Net Center over there, at the old Avondale East School, as well as the Oakland Community Center, to specifically be in the neighborhoods and get their impact from those communities. Additionally, for the first time, we got outside of Topeka, and we engaged and put a focus group in Silver Lake. So a lot of times, and we look at this, and again, talking about this as the community's plan, we look at where the vast majority of our population is, and that's here in the city of Topeka, right? And so a lot of times we forget to engage Silver Lake, Rossville, Auburn, Tecumseh, and some of the outlying districts. So we did focus groups out in Silver Lake, and that was actually our best attended focus group by far. We had over 30 individuals from there. We had sheriff's officers, we had TPD that were there. They even came to the Silver Lake one because they couldn't make it to the other focus groups. It was really great to see and really hear specifically from the community members how they perceived and what their perception of the needs were in their specific neighborhoods, okay? From there, we also even then held our normal stakeholder town hall, which we had at the health department, and invited all of our major stakeholders in the work that started in 2015 and moved forward to kind of then take what we learned from those community town halls and then kind of help us do the first priority setting based on review of the data, review of the community's perception through the health assessment, as well as through these focus groups. And so they helped us set kind of basically on that, looking at what those first 16 health priorities were for our community. So we did the analysis of the data. We identified, like I said, through all of those stakeholder engagements, then a list of potential health priorities. When we looked at that, based on all of that analysis, like I said, we came up with 16 priorities. Well, as most of you know here, that is a lot. And it is very difficult to truly impact really any change if you're going to really look at trying to impact 16 different things in a single community. And so when we looked at that, the first step that we did as a steering committee for our needs assessment and for the community health improvement plan was to see if there were certain priorities that we could group together. And then from there, we did a priority setting kind of piece to the whole process. So we had 2 community meetings, one which was with Leadership Greater Topeka, and they were very clear. He told me they were the best class ever, so that this was going to be the best data collection that we could possibly do. So, but I think every class says that, right? And so we met with the Leadership Greater Topeka. Is everyone in here familiar with Leadership Greater Topeka? Seeing a lot of nods, perfect. So the great thing and the reason that we chose Leadership Greater Topeka cohort was very diverse group of individuals. All right? These were individuals, when we asked that question that we asked here to start this one, who's familiar with the CHIP, who's familiar with the needs assessment, we just had a handful of hands that went up. And similar to this group, we only had 2 of the 40 individuals who had taken the survey. And so you have a very diverse people who don't just specifically work in health. So we wanted to get an understanding from them, what was to them, looking at this criteria, how do they perceive, what is the feasibility, the seriousness, the concern, magnitude, or responsiveness on those 16 priority areas, so that we could hopefully use that information. And then at our second community meeting, which was our April HHN meeting, where we do an overview of the county health rankings each year. And this year we had a standing room only meeting at the library. We had over 120 participants from neighborhoods, from community organizations, very well turned out to do that same priority setting exercise. We had partnered with the Kansas Health Institute. They came in and facilitated the exercise and did all of the priority scoring through the matrix. And so from those 2 meetings where we engaged a very diverse collection of stakeholders and individuals, we were able to then identify and take those 16 priorities and whittle it down in half to 8. To make it a little bit, because the goal here was to make it so that we could select priorities that we could tangibly make a difference on, right? And so what we came up with were, in the end, because we were able to, as a steering committee, group this down even a little bit further, we came up with these 4 community health priority areas for the Community Health Improvement Plan. So the first being behavioral health, all right? So the top 2 priorities, indicators that came out of that matrix were access to behavioral health care and suicide prevention. So what we did was we grouped those 2 together under behavioral health, because a lot of, through then some additional meetings that we held with organizations and stakeholders, a lot of the same people at the table. And so if we're going to look at making an impact, we want to make sure through this entire process to make sure that we use everybody's time as efficiently and effectively as possible, that we leverage each other's resources, that we're not going to a meeting just to go to a meeting, that it is really truly a good use of your time. And so when we did that, we were able to identify a couple of additional gaps. There's 10 different meetings that are related to some sort of behavioral health. And it's very cross-cutting when you look at the matrix for all these areas. But there's no community group or organization that is looking at behavioral health as a whole. There's no real community group or organization where your mental health centers, where Stormont Vail Behavioral Health is at the table, where all your community organizations that are impacting a facet of behavioral health are all together. We're all working on parallel pathways, trying to compete for the same resources, and sometimes that creates a challenge. And so I'll dive into a little bit further, but one of our first pieces was like, maybe it would be a good idea to maybe bring everybody into the same room and have a conversation and see about having that group help us truly decide what the most effective interventions would be. So that's an ongoing process that we're working on right now, is trying to develop that collaborative to then put all the resources together, all those partners together, to make sure that we make the biggest impact. The other piece that I mentioned was that suicide prevention. Well, there's already a group working on that. So it's not our goal to reinvent the wheel. We don't want to, as Heartland Health and Neighborhoods, it's not our goal to take ownership of any process. Again, this is what the community wants to work on. And so it's our goals then as HHN to basically be like, okay, there's a suicide prevention coalition that has a long track record of working on interventions in our community. What can we do to help? How do we leverage our resources and the capacity that we have, both as Heartland Health and Neighborhoods, but also as the health department, as Stormont Vail, the primary investors into this community health improvement plan? Are there ways that we can help you impact change? Either by helping to provide technical assistance, grant writing, connecting you with other organizations and resources in the community to make a difference. So through those conversations, we've had the suicide prevention kind of come on board, adopt the CHIP kind of as a strategic plan, and helped us truly actually develop what the goals, the priorities, and the intervention strategies are going to be outlined in the plan itself. Access to food, that was our number 3 priority. listed behind mental health or behavioral health and suicide. A lot already happening in access to health. This is a holdover from our last community health improvement plan. Heartland Health Neighborhoods has a healthy eating work group already. We're in the process and have already created the Shawnee County Farm and Food Advisory Council to look specifically at food access and food insecurity issues in our community. So that's a great first step that kind of is a holdover and a continuation of that last chip. And so that has been built in here as well. The third priority is substance abuse. And so Michelle kind of already talked about it a little bit. Again, a substance abuse task force in this community. So again, how do we leverage ongoing groups, ongoing resources to work on this? So we've had some meetings with that group to help us develop what are the priorities, what are the goals, what are some of the intervention strategies that we can look at. And so a lot of the work that we've been doing around substance abuse has been happening in a sense in silos, or that we've all been doing kind of similar work, but we haven't been leveraging each other as resources for this. And so we grouped tobacco and vaping into this. This is opioids, alcohol, and other illegal substances of abuse, all falling underneath this same priority area. So a large priority area, but we think we chose some goals and some objective measures that we really, truly think that we can make an impact on. The last group here is health equity. And so we had multiple priority areas through the process that came about that either were work that was ongoing that we had done that were ongoing doing in our community, or that we needed to take a different approach to. And we had been doing maybe a lot of programmatic stuff. Maybe we hadn't been looking big picture. Maybe we had been making some small incremental impacts in it, but we thought we could go a little bit bigger. And so in this group, so maternal child health, obesity, and sexually transmitted infections, we're specifically started looking at those specific social determinants of health, looking at specific demographics and populations in our community where we know maybe sexually transmitted infection rates are much higher, working with like Washburn University, where the student population, you know, that age group from basically 15 to 24 is where some of our most high rates for sexually transmitted infections are. So we're going to do some more targeted interventions, either through policies and the like, to make an impact on these. So we pulled these out specifically into a priority area itself to make sure that we targeted at much larger, big pictures, and some of the data that we have here is, again, maybe a little bit more specific to either zip codes. Our 05 zip code in our community here, when we started this process, had the highest infant mortality rate in the entire state of Kansas. All right, and then it had gone down. And now we have another zip code, and I should have wrote it down. It's not the 05, but we have another zip code again that is also the highest infant mortality rate in the state of Kansas, again, from last year's data. And so we know that there are some specific things that we need to target in those specific areas, those specific zip codes. An example of that is, so who knew that we had a community baby shower this weekend on Saturday? Couple people. So that started 4 years ago as a response to this, because that 05 zip code had the highest infant mortality rate in the community. And what we were able to identify was safe sleep practices, and not knowing safe sleep practices was a contributing factor to that infant mortality rate. So what we did was partner with Avondale East, multiple community partners, and hosted a community baby shower on safe sleep in the 05 zip code, partnered with the bus to make sure that we had free bus passes for individuals to come to this community baby shower. They came through that, they did a walkabout training, got a lot of information. They walked out of that with a safe sleep environment, with a pack and play that was certified as a safe sleep environment for some individuals who might not have already had that, might not have the resources for any number of reasons. So that's just an example of a sustainable change that we've made to try to impact some of these numbers. All right, so I've talked a lot about this already. Not the first time that I've jumped ahead on slides. But so when we look at the CHIP structure, we have a priority area, multiple goals, objectives, strategies, and action steps. So it's a very detailed strategic plan to look at this. The biggest thing that I want to point out about this plan is this is not a plan that's created to just sit on a shelf. All right? This is a plan that is designed specifically to evolve as the community's needs evolve. And so what that means is basically if needs arise, data changes, things shift, we are able to specifically relate and impact those those outcomes or whatever as the needs arise. So if something shifts and changes, a zip code that we need to target specifically or something else rises to the top that we need to impact, we have the ability to update and change the plan as needed because there should be constant evaluation that's going on. We're going to be constantly evolving what we're doing to make sure that, again, we're using everybody effectively as we possibly can. So we have a SIP Cheering Committee that is reviewing this quarterly. That's the Shawnee County Health Department, Stormont Vale Health. The reason those two organizations are there is specifically because the Health Department, we have to have a community health improvement plan for our accreditation. All right. Stormont Vale has to have a community health improvement plan for IRS guidelines for their nonprofit status as a hospital. And then in HHN leadership, we have the senior leadership, which is the immediate past chair, the chair, and the vice chair, who serve basically as the steering committee to make sure that we are truly impacting health as positively as we can. Okay. So I've talked a lot about this, but this is kind of an overwhelming chart, if you will, of basically the priority areas and all the partnering organizations that are kind of at the table. So here in the middle, these groups here, these 5, these are the partnering work groups that were already at the table as part of Heartland Healthy Neighborhoods. These are the groups that are already actively meeting, and so where some of the work continues to fall in line. If you look over here, partnering groups, the Suicide Prevention Coalition, the Substance Abuse Task Force, again, those are 2 groups that we recognize in our community that we're doing this work already. So why recreate the wheel and look at really partnering with them to help us develop the best chip that we possibly can and have them kind of tell us as the content experts what are the effective intervention strategies, the evidence-based practices that we can do to impact that work. Then on the side over here, these ones, the Kujima Collective, the Behavioral Health Collaborative, and the SCI Collaborative. These are newer pieces either that need to be created, so you'll see the to be determined pieces here, or the Kujima Collective. Who is it? Anybody familiar here with the Kujima Collective at all? 1 person, 2 people? Okay, perfect. So the Kujima Collective is a report that Chris Omni did through a partnership with KHI to specifically look at African American health disparities in our community. And so what she did was specifically looked at what were the highest health disparities affecting African Americans in Shawnee County and Topeka. When she did that work, she was able to highlight a lot of health priorities that were detrimental, and especially that related to chronic disease. A lot of that work that happened there and the findings related specifically right back into a lot of the priorities, mental health, to substance abuse, access to food, and health equity issues that we're all talking about in the CHIP. And so we partnered again with Chris Omni, and she presented at our April meeting with Heartland Healthy Neighborhoods those findings and that Kujima report, because a lot of that coincides. Again, why do we need to recreate the wheel or create something that is there? Again, trying to figure out how to effectively collaborate with the partners in the work that's already going on in our community. If you haven't sensed a trend yet, it's called collaboration, right? Okay. So I've already kind of talked about this a little bit, but community strategies, just kind of talking about the highlights. Behavioral health, this is a new kind of piece for us in public health. We know we're not the content experts at the health department. And so we should not be the people who are developing what the strategies are to impact behavioral health in our community. So again, it goes back to we're trying to bring the right stakeholders to the table to make sure that we are effectively choosing what the most appropriate interventions are, and that we are partnering together to, again, apply for grants or whatever the funding is to make an impact. And so behavioral health, really the biggest highlight for that is we have started identifying who those people are, who those partners are, and started some of those capacity building meetings to make sure that when we start this plan really in 2020, that we're on the right track developing interventions that will impact our community. Access to food. I could spend an entire day talking about the great things that have happened on access to food. If you want to hear that presentation, I'll be at the K-State Extension's annual meeting next week, 2 weeks from now, talking specifically about that. But one of the big things that's happening with access to food is the creation of a Farm and Food Advisory Council for our community. And this is a group specifically selected from multiple food sectors to advise both stakeholders at the city and the county, but also stakeholders and organizations on policy, systems, and environmental changes that can impact our food system in our community. There's already been a lot of great work that's happening on this with partnering with organizations, summer feeding sites, things of that sort, community gardens. There's been work at the city for policies to work on vacant lots that make it available to do community gardens. So there's a lot that's happening on food access, and there's a lot more that's in the work right now with incubator kitchens and making sure that we can get food and resources to students who maybe their only meal is happening at school for breakfast or lunch, and they don't have an access to food at home. And as most of you, or maybe a lot of you know, a very large portion of our community in the city of Topeka is a food desert, with the closure of that Dillon's at the corner of, is that Huntoon and Washburn Lane? Yeah, one of those two, right? Because it's two ways. So, so there's a lot of work going right now to do a market feasibility study to look at where's an effective place to put a grocery store back in central Topeka if it's even possible. You might know the grocery store in Oakland closed, Mike's IGA, right? So it's closed as well. The grocery store in Auburn closed as well. So we've looked at in our community in Shawnee County, 3 and maybe even a 4th grocery store closing and really impacting individuals' access to fresh produce and healthy foods in our community. Substance use. Vaping is a major issue in our community. It has truly become, and we have recognized it truly as an epidemic in our community and moving forward. And so what we're really looking at is how can we effectively make an impact to reduce those rates, both in vaping, alcohol use, opioids. That's the next piece that we're really looking at is effectively developing a plan to impact when that becomes really truly an issue here in our community as well. And then health equity, I kind of already talked about the community baby showers as an impact. Obesity, we're looking at complete streets policies to make sure that we can, multimodal transportation is available in our community. And then STIs. We've never had a group that specifically looked at STIs in our community. And so we're trying to bring together a diverse group of partners in our community through school districts. And so it's not just the health department or the hospitals trying to impact it in their own individual organizations. That we really look at this as a community issue so that we truly impact this at the root issue where most of the issues lie. So next steps. We've done our assessment. We're in that middle part, so the CHIP, developing the strategies and the action plans. That's kind of continues to be an ongoing process as well. As I said, this is a plan that evolves with time as we kind of identify what the needs are. And then the implementation starts in 2020. Really, truly try to create what the policies, the systems, and the environmental changes are in our community to impact health. And then through that entire process is the evaluation and the community capacity building. So partnering with the organizations that might not see what they do as impacting public health. I always, Trey's in the building, so I can really shout him out here, but we've always used the Housing Authority as kind of a gold standard for how to impact public health. And a lot of times he's not in the meeting when I'm talking about him, but he's here today, so I'll try not to embarrass him too much. But we looked at many moons ago, I want to say 2016, to impacting East Topeka with the food access stuff and smoking rates on that side. And the Housing Authority at the time maybe didn't really think what the work that they were doing was impacting public health, but through some community conversations and some meetings, we started a farmer's market on the east side of Topeka. We were able to get it so that it was SNAP eligible, so individuals could use their SNAP benefits because a lot of the demographic in the population that resides at their properties, they have those benefits, right? And then also, some of the highest smoking rates were in those areas where they had properties. So we developed, before the HUD ruling came down, the first 100% tobacco-free public housing in the state of Kansas, which you guys won an award for. Again, congratulations. And so, there's a lot of great works, and sometimes it's these types of meetings where it's like, maybe what I do in my organization doesn't impact health. But I'm here to tell you that no matter what you do, in your organization, in your day-to-day life, has an impact on the community's health in some facet, whether it's at a small scale or at a very large scale. And so truly, we want to figure out how to effectively use you and partner with you to build this community capacity and the coordination to respond to our priorities. And again, to impact health, we have to cross-cut across a lot of sectors. And again, the word of the day is collaboration, is to figure out how we can collaborate with a multitude of different partners from a multitude of different sectors to impact health. It's not just the city government, it's not just the county government's role, it's not just the health sector's role to do this. This is everybody. This is from you as a family and what you do in your family. This is what you do in your organizations. This is what you do across the whole gambit of our community. So that was deep, right? So, so the key takeaways, again, the collaboration piece, awareness of what truly is impacting our health. It's not just healthcare, it's not just your genetic and who you are as an individual, but truly it's where somebody lives. The new mantra is that your zip code truly does have a bigger impact on your health nowadays than your genetic code, okay? Identification of the gaps and barriers. So what are those root causes actually of health in our community, whether that is access to transportation, income, the whole piece, right, okay? Piece is screening for social determinants. Are you a social service organization? Do you screen for social determinants of health? Are you referring to other organizations? Can we streamline those referral processes? I think I have that on, the next one is comprehensive referral systems. Are there ways to effectively refer a little bit better maybe from one organization to another to impact health, to make sure nobody's getting lost in the middle, right? And then the last piece, again, is that collaboration. I think I've said it enough. Collaboration is key. No one person can do this alone. And so truly we look forward to how can we help you improve health of the community, your own health, and then help make sure that Shawnee County and Topeka is really the best place to live, work, and play. I think that's something that a lot of us want to make sure that we do. So my contact information is up here. I'll have some cards available at the end if you guys want to follow up. I'll take questions. I put Susan Kamen. She's typically the person who does these presentations, but she is actually presenting in Philadelphia to the American Public Health Association on community health improvement plans. So she had something cooler to do. No, just kidding. So she is the community health planner. She's kind of the lead person on the implementation of the CHIP. She's kind of the point contact, but myself as well with the health department or through Heartland Healthy Neighborhoods. So with that, questions? More than happy to take questions. Yes, ma'am. Yeah. Who's on that actual council? Yeah. So right now it's a 13-member council. Our goal in our bylaws is, so we have some meetings we have to do with the county commission and the city councils to try to get appointments to be truly an advisory council. But right now we have 13 members, so wide variety of sectors. We have an individual from Washburn University, Harvesters, K-State Extension. We have an independent dietitian, Stormont Vale, a community volunteer who is kind of leading a health nutrition incubator to like startup kitchens. We have farmers. We have individuals from the, what do you call them, grocery chains. School districts are at the table. What do you mean by contractor education side? So Topeka Public Schools as in like food services, yep. And so we had individuals that were on the task force that helped us kind of develop this all in the process as well. The United Way, the Gil Carter Initiative. You put me on the spot. I'm trying to name everybody of all 13. I don't know how many I just named, but we'll say that's probably pretty comprehensive right now. Okay, yeah. So the goal of this through the task force, and I sat on the task force that developed and screened we had almost 35 applicants for those 13 spots. And so our goal was to specifically try to have somebody from every sector of the food system, right? So obviously some of the ones, we didn't have anybody from food waste, which is a huge issue in our community, the amount of food that is wasted that could be repurposed in our community. That's a huge issue, but so we're still looking for somebody at that level. But our goal was to try to get somebody from every single sector of the food system. So, any other questions I can answer for you? I know I didn't cover everything, so I'm sure somebody's got to have some questions. Perfect, yes. Perceiving that vaping is an issue? Right. So I can't answer your question in total. I can try to do a little bit of research and put my EPI on it, and we can try to overlay some of the meth statistics through some of the syndromic surveillance that we do, and try to see if some of the, specifically in like zip code census tracts, if some of the reported usage for vaping and meth usage can be overlaid. That's something we can do. I don't have that data for you. But I would be hesitant to say that it's a perception that vaping's an issue. I would say more so that I don't want to say that it's 100% known that it's an issue, but we have done a lot of education, and Lynn can probably speak to this as well, in the schools, and through surveys that have shown, what's the percentage increase over the last 3 years for vaping? So 4.9% to 12%. So you're looking at a triple in 3 years, basically, for vaping.
In relation to the long-term property crime,
Mm-hmm.
the court system, like all of the expenses that come from amphetamine addiction compared
To vaping. I see what you're saying now. Yeah. Okay. Yeah. I don't know the answer to that. I don't, and I apologize. But I can try to see if we can try to figure out something that might be able to overlay that. At first notion, I would say that there's probably not enough data yet, because vaping truly is an emerging trend. We've got 3 years of data, and I'll be honest with you, when I started and switched from clinical health, and moved into public health 8 years ago, vaping wasn't even a thing. Like that, what we didn't, we were still working specifically on the old notion of specifically targeting cigarettes and smokeless tobacco. It wasn't until, I would say, late 2014, 2015 that we really started identifying vaping as an issue. And I wouldn't even say we identified it as an issue. We just thought it was going to be one of those trends that might come and go real quick. FDA didn't hop on it as quickly as we anticipated that they probably would have. So I don't know that we have enough data yet to specifically fully answer your question, but I can see what we have. Yeah. Sorry, very long, drawn-out response to that. Anything else? What else? Okay. Well, thank you again for your time. And again, I'll have some cards. I don't know where the most effective place would be to put it, but would love to figure out how we can effectively engage you all in this work moving forward. So, thank you.
So, do you know everything about the chip now? I've heard Craig talk about this, and I don't know if you've had the experience where you hear something and then you hear it again and you hear it in a different way, or you start putting connections together. And when we talked about having Craig talk about this, I was a little nervous about thinking, okay, what will people that are coming to a Safe Streets Coalition think that what does this have to do with crime? So when Safe Street started, and Max, and I think John, anybody else around when Safe Streets first started? A few? Okay, so there was a death in the community, and kind of an uproar about that, and looking at how can we address crime through substance abuse prevention, because we know that substance abuse and crime are very integrally related. And when I saw the 4 priorities, and I'll name them off because they're not here, but behavioral health, substance use, access to food, and health equity, do you think any of those have anything to do with crime? They all do, in some way, shape, or form. So we're kind of turning a tide. Like in the last year, we brought in the conversation about human trafficking. And that does have to do with crime. It also has to do a lot with what Craig talked about was social determinants of health. And in some of our meetings, we talked about upstream things. How are we going to reduce crime, mental health issues, all of the health, social problems that we have, how are we going to address them? And we get to that by those upstream things, looking at health, equity, with food, with substance abuse, behavioral health. So we're going to try to bring about some of those things to our meetings, more about trying to, what are these linkages? And what's happened with the CHIP in our conversations is we're turning in a grant together today to deal with and develop a strategic plan on opioid response and prevention. That came about through the partnership. There was also a group that I was involved with, that the hospitals, Grace Med, and some other groups got together to talk about patients who were essentially shopping for docs to give them prescription drugs. And this group started about 3 years ago. It's become a Shawnee County prescription drug collaborative. We started talking about the CHIP, and there's opioids involved in the substance abuse priorities, vaping, marijuana, alcohol. So that group is now joining the Substance Abuse Task Force, which is a group that PARS has coordinated for several years, and it's all part of this dynamic. So I guess my ask for you all is to put down what are some other topics that you're curious about, that we can bring to these meetings, how we can make connections, how we can bring more people like we did with the human trafficking issue, because everybody doesn't want to think about substance abuse, but it is a big problem, and we'll talk about how that's impacting our crime rates at a future meeting. So I want to thank you for coming. Craig, thank you for sharing all of the hard work that's been going on and the partnerships that are growing. And with that, I will tell you one other thing, talking about vaping. November 12th, Seaman High School is going to do an evening event to bring parents in and kids and talk about what's going on, because we're already seeing a lot more of that in our community and kids, and looking at policies related to that, because it is, as we've seen in the national news, it is becoming an issue. It may not have the financial impact, the economic impact that we have with other drugs right now, but anyway, so lots of things going on, and we want to help share that information so that you can all pass it along in your respective groups. So thank you for coming, and enjoy the sunny weather while we have it. Take care.